Reading is this task that we put every kid into, and if they're not amazing, it's like panic stations. But in essence, there's a natural inclination that some kids are going to be naturally good at reading and some kids aren't. And so I have to have the chat with them that, like, this is a pain because reading isn't going to be your jam. We need to do everything we can to make reading as easy as possible.
Let's bust a myth. What is one of the most common misconceptions about kids' vision that you wish every teacher knew?
Yeah, so I think
Let's just have a little chat about screen time.
I love this chat. So screen time, one thing I like to split screen time into is
Rainbow Sky Creations acknowledges the traditional owners of the land we have recorded this podcast on, the Dharawal and Whadjuk Noongar people. We pay our respects to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander cultures.
Hello and welcome back to Rainbow Skies for Teachers. Today we're talking about vision. In this episode, we are joined by expert Amy Fortescue, and we're going to unpack how children's vision can deeply affect their learning, their behaviour, and their classroom confidence. We're going to talk all about behavioural optometry, what it is and why it actually matters in education, how to spot some of those hidden visual problems in your classroom, what visual processing is, and how to help students in your class by making some little tweaks and little changes. I could listen to Amy all day long because she is just a wealth of information, and I love how she puts everything into stories to make things so clear and so obvious. So without further ado, here is Amy. All right, Amy, let's start back to the very basics. What exactly is behavioural optometry and how is this different from a regular optometrist?
Yeah, so I look at behavioural optometry as holistic optometry. I think traditionally, general optometry and ophthalmology. So, ophthalmology is where you study medicine to become a doctor and then you specialise in eyes. So, that's when you hear about ophthalmologists. Some people get a bit confused what the difference is. General optometry and ophthalmology, I believe, look at the eyes like they're almost separate entities of the body, whereas behavioural optometry looks at the eyes like they're very much part of the body. One of the main sort of foundations of behavioural optometry is that there's a difference between eyesight and vision. So optometry and ophthalmology will look at your eyesight. And what your eyesight is when you first come in and you sit in the chair and the optometrist puts up the letters on the chart and says, okay, what letters can you see? Ideally, we want everyone to be able to see the 20/20 line. And what the 20/20 line is basically what the average person can see at 20 feet. It means you can see that line from 20 feet. And in Australia, we actually say it's 6'6" because we talk meters, not feet.
Oh, that's interesting.
Yeah, so if you hear 20/20 in Australia, it's 6'6". But what eyesight is, yeah, I can see the bottom line. What vision is, vision's really looking at how does the brain interpret the information that's coming in. So when we talk about vision, I split vision into 3 different sections. I look at visual function. So visual function is, yeah, can you see the 20/20 line? The next level is visual efficiency. So visual efficiency is how well are you using your eyes? And then visual processing is how well is the brain processing the information that's coming in. So I think the key is that behavioural optometry looks at vision, and vision comes from the brain. So behavioural optometry is really looking more at the brain. And one of the examples I use about vision is that when patients come in, sometimes I'll have a patient come in and they'll be really stressed and they'll say, I can't see. And I sit them down and I get them to look at the chart and they read that 20/20 line. And in most cases, if that happened and they were at a general optometrist or an ophthalmologist and their eye health was fine, they'd be dismissed. They'd be like, no, you can see, you're fine. But what happens in people that are stressed is that their zoom in, zoom out function of their eyeball, because our eye has a little lens in it that zooms in and zooms out like a camera, that zoom in, zoom out function can get really badly affected when we're stressed. And it can really affect the ability to focus on where we should be looking. And so it's interesting that, yeah, I'll have patients that come in and sometimes I can just see how they're using their visual system and I'll be like, are you under a lot of stress? And they'll be like, oh, actually, yes. How did you know that? And that's where I'll say, well, look, your eyes connected to your brain and your eyes are playing up because your brain's in a stressed state. So I guess that's a nice example of that holistic side of optometry and what behavioural optometry is.
Yeah, that is so fascinating because the more that we learn about people, behaviours, the more we find that everything is all connected. So you're saying that the eyes are the same, everything is all connected.
Yeah, 100%.
Which is why it's important as teachers that we know a little bit about this for the kids in our classroom. So tell me, many teachers are the first to notice that when something's not quite right with a child, with their learning, their behaviour, perhaps their eyesight. What are some signs that a teacher might notice in the classroom that could suggest that a child is experiencing some sort of visual challenges?
Yeah, look, I personally think that if a child has any learning issue of any kind, they really need to have their eyes checked. We know that 82% of learning issues involve reading issues. And I think one of the major issues that we have for a lot of families is that in New South Wales and in most states of Australia, they have screening programs where nurses will go into preschools and they'll screen the children to make sure that they can see. And a lot of parents will think that the child has had their eyes tested. And in essence, the screeners pick up major vision problems. So they'll pick up like if the child can't see at all, but they miss a lot of minor vision problems. And it's the minor vision problems that can have quite a major effect on learning. So if we talk about what are the major signs that teachers will notice, there's the obvious ones: eye rubbing, wanting to get close to the board, sitting really close to the page. They're the obvious signs. But I do think any sort of learning related issue in the class would deem them necessary for an eye test. A big one is avoidance. The kids that just don't want to do the task at all. Sit the child down. Okay, we're going to do some reading. And they just don't want a bar of it. That child should have their vision checked. It's interesting with reading. One of the things I say to every parent that comes in is that reading is not a natural task. If we look at human civilization as having been going for 24 hours, we've been reading for 18 to 20 seconds of that 24 hours. That's how long humans have been reading for.
What? That's
Yeah. So
crazy.
this is a really new task. And the assumption that every kid should just be able to pick up a book and learn, it's not a natural thing. Humans weren't wired for reading. I always say to kids, by the time they come in to see me, they're rather deflated because they've been flagged that there's a problem. I say, if we look at soccer as an example, most kids will have a go at soccer. And when you put them into soccer, some of them are so good at it, and you just go, "Oh wow, this is your sport. We're gonna run with this." And other kids like me, my parents put me into soccer, and I was hopeless. So we did one season, and they went, "Not doing that anymore." Reading is this task that we put every kid into, and if they're not amazing, it's like panic stations. But in essence, there's a natural inclination that some kids are going to be naturally good at reading and some kids aren't. And so I have to have the chat with them that, like, this is a pain because reading isn't going to be your jam. We need to do everything we can to make reading as easy as possible so we can get you through as many years of education as possible. But coming back to your question, yeah, the main thing I would say is avoidance and any vision related issue. The other ones are obvious. They'll be the red flags that you'll see and not miss it.
Yeah, avoidance is a really interesting one because I think that teachers or parents might actually veer in other directions if they notice avoidance. But for me as a teacher, I'll often say, let's get the hearing and the eyes tested first as
Yeah.
like little check boxes because that's so true that you might pick something up. That happened with my own daughter. The teacher picked something up with her and it was just minor. She was like, she's just not progressing the way that I would expect her to. She wasn't having trouble reading. She could read, but the teacher just thought not to the potential that she should. So I brought her into you because, of course, Amy's the best, you guys. And we picked up that it was just a tracking issue. And as soon as she gave her the glasses that she needed, we just saw the most marked improvement. But not only that, now this child wants to read. She enjoys reading. She's not finding it so tricky anymore. That confidence has really built, which is amazing.
That's so good. I love hearing those stories, Ash.
Yeah, that's true.
Yeah, it's really good. And I think tracking's another one, like the kids that are moving their head. I call it the typewriter head. When if a kid's reading and they're moving their head around, again, go and get their eyes checked. Any little sign that just you think that could be something, as I said, don't rule, that when you ask the parent, have they had their eyes checked? And they say yes. Clarify, was it just a screener at preschool? The other one to clarify is, was it just a Westfield
Yeah.
optometrist?
Yeah.
Because again, some of those Westfield optometrists are just looking at eyesight. They're not looking at all the other facets, all the other parts, which we'll get into as we talk today.
Yeah, I was going to lead you into that as well.
Yeah.
A behavioural optometrist or behavioural optometry is different to the optometrist that's just testing their eyes, seeing whether they've got that. Kids don't have 20/20 vision, do they?
It's funny, they get there. Usually kindergarten, they don't.
Yeah,
By
okay.
year 1, year 2, they're usually there.
So
Yeah.
We have a funny story. Many years ago, I was teaching a grade 3 class and I was standing at the back of the room and I was having trouble reading what was on the smart board at the very front. And the kids kept saying to me, they were really like quiet, just a really calm kind of class. And they were like, "You can't read that. We can read that really easily." And I was like, "What?" And it happened a couple of times. And then I was with my husband. He's got like incredible vision. Like his vision is next level. And I was noticing that he could see things really far away that I couldn't. So I was like, "Oh, okay, maybe I've got an eye issue." So I go to Amy and she's like, "Your eyes are totally fine." And it just so happened that my class were playing a trick on me.
Oh, that's funny. How good are kids, hey? How good are kids?
So visual processing is a term that gets thrown around a lot in education. Can you explain what visual processing actually is and why it actually matters to learning?
Yeah, so before I go to visual processing, I'll just take you through like the steps of how I look at vision. So I alluded to it before with visual function. So visual function is, are the eyes healthy and are they receiving the light? So is there any major prescription? Visual efficiency is, I break it into three things. So visual efficiency is how, if we think of the eyes like little cameras, how well are they zooming in and zooming out? How well are they pointing together? So are they both pointing at the exact same spot in space? That's what we call eye teaming. So we've got 6 little muscles on each eye and they've got to aim the eyes to the exact same point in space. And then eye tracking is, yeah, how well are the eyes working together to move smoothly across a page or jump across a page or moving in space. Visual processing is basically how well is the brain interpreting that information that's coming. So in order for visual processing to be good, visual function has to be good and visual efficiency has to be good. Visual processing is basically looking at a few different things. And in behavioural optometry, some of the things we look at, visual discrimination. So visual discrimination is if I showed a child one image and then I showed them 5 options, which one of these options matches that image? So can you match? So visual processing can be split into sort of different categories. Visual discrimination is one, and that's basically saying, can you pick similarities between images? Visual spatial relationships is, can you determine differences between images? Visual memory is how well can you remember what you've seen? So if I flash up a picture of a circle, what shape did I just flash up? Visual sequential memory is if I put a pattern of images, can you remember the pattern and how long can you remember that pattern? So it might be circle, triangle, square, circle, triangle, square. And if you think about what a word is, visual sequential memory, remembering how to spell words, the order of those letters, that would require visual sequential memory, particularly for sight words. Visualization, which is the ability to actually visually see something in your brain. And I always use the example of when you're reading a book as an adult. If you're reading and you're reading the text, but you're not seeing the text in your brain, you're seeing the images of what you're reading. That's a great way of describing visualization. With kids, we get them to like hold something in their hand and say, what can you see in your mind? You're holding it in your hand, but what can you see in your mind? And we look at things like visual motor skills. So yeah, how well can you copy something you have seen? So there's some of the like kind of a few examples of visual processing skills. But as I said, it's really important that before we look at visual processing, we make sure that the kid's visual function is good. And we also make sure that the child's visual efficiency skills are on fire. So when it comes to treating a child, I'll often give them glasses and some exercises to make sure that their visual function and visual efficiency are good before I'll even assess visual processing. Because it's a bit like, let's make sure that the input is good before we then go, oh, they've got a visual memory problem. One of the examples I always come back to is my husband. So he developed a thing called astigmatism. Probably, I'm thinking it was probably when he was in early primary school. And what that meant was that he could see, but everything was a bit distorted. As time went on, his visual memory skills got worse because basically the imagery that was coming into his brain wasn't clear. So when he was seeing a word, he wasn't getting a clear image of the word, he was getting a blurry image of the word. So then he ended up having terrible spelling. And the question for me was always, was it fundamentally a visual memory problem? Or was it the fact that he just didn't have good input coming in?
It could be a combination of both, right?
I would say so. And it's funny because my son is like a mini husband. And looking at him, he's got a very different brain to how my daughter works. But looking at how his visual memory is working at the moment, because I keep checking his script every like 6 months, I know the input's clear at the moment and his visual memory skills are actually building much better than I expected. So it's interesting. Certainly it's all connected for sure.
Yeah. So, okay, let's hone in a little bit more on reading.
Yeah.
How can an undiagnosed vision issue affect a child's ability to learn to read or then just stay engaged in general literacy activities like what we're doing in the classroom every day?
Yeah, and look, that's exactly what I was just talking about with my husband. So he had an undiagnosed vision issue. And as I said, that really affected his visual memory skills and then his joy of reading. So if we go back to basics, the visual function, which is like, has the child got an eye health issue or is there a prescription issue that's causing them to not be able to see clearly? Those things are absolutely going to affect a child's ability to read. So if the input's not good, that's going to make reading difficult. One of the things that I'm always worried about missing when kids come in is long-sightedness. So most kids are a little bit long-sighted. In fact, that's what we want them to be. So we talk in numbers with long-sightedness, and most kids are like 0.5 plus 0.5. That's like the kind of nice amount we want them to be by that year 1. But the problem with kids is that they have an amazing ability to use their little focusing lens to hide long-sightedness. So essentially, long-sightedness is where in most cases the eyeball is too small. And so when light enters the eye, it doesn't focus properly in the right spot on the retina, which is like the film of the camera. When kids have long-sightedness, they can use their little focusing lens to adjust the way the light enters their eye so that it can refocus. But what we find is that these kids have to exert a lot more effort to getting things clear. So by the time the light comes in, they refocus the light and they're now getting a clear image. They're not comprehending what they're reading. They're just getting it out. They're like, okay, I've read the words, now what? And so these are the kids that are usually in kindergarten, they scrape through and then the wheels start falling off as we start to ask them comprehension questions. And we want to make sure that they're actually understanding what they've read. We know that if a child has a prescription of say +3 to +6, which is a fair bit more than +0.5, they will have a significant reduction on test scores. But we know that even a low amount of long-sightedness, so even a 1.25 will affect their achievement scores in tests. So we know that undiagnosed prescriptions can certainly affect their ability to read and how well they can stay engaged. Things like myopia, which is short-sightedness, which is something that we're seeing a lot more around the world. In fact, I think they're saying that by 2050, 75% of the world's population will be short-sighted. So short-sighted is where you can see up close, you can't see in the distance. Those kids typically are really good at reading because they're clear at near. They're the ones that can't copy off the board. So they're the ones that the teachers flag really quickly because they make more noise. So the visual function issues, they're very clearly going to affect a child's ability to read. If we go into visual efficiency, this is where we talk about eye tracking and eye focusing and eye teaming. These are the kids that certainly are the ones that are more like your daughter, where they kind of are going okay, and then we just feel like they're not really reaching their potential. They're more my visual efficiency kids. And basically, they're the ones they can see okay, but they're not using their eyes to the best of their ability. And that's where I get lots of referrals for like eye tracking and things like that. One thing that's interesting with eye tracking, and this is a bit controversial, but I actually find that most kids that are good at sport are quite good at eye tracking, but they haven't been taught how to do it properly in the classroom. So a lot of it's just about making sure they've got the right posture, they're sitting up still, they're keeping their head still, and they're just moving their eyes. So I get a lot of referrals for tracking, and often the kid actually can track. They're just not doing it correctly in the classroom setting.
Yeah.
Another visual efficiency issue that we see a lot of is eye focusing issues. And that was that stress example I was giving at the beginning. One of my favorite sort of stories in behavioural optometry is a thing called near point stress. And near point stress is a great one. So the premise of near point stress is that in humans, we have the fight or flight response, which a lot of people are familiar with. And basically that's where when we're put in a situation where we're under stress, our sympathetic nervous system switches on and it puts us into a state of fight or flight. When that happens, our autonomic nervous system, which is the system in our body we have no control over, will take over. And it basically focuses our eyes into the distance to see what's coming to get us. So this has been built in our systems from when there were animals coming to try and get us in the wild. So what happens is we're stressed Our eyes focus into the distance. But what's happening in the classroom setting is in a child who's not finding that reading is coming naturally to them, which, as I said, happens for a lot of kids. They pick up the reading task and the stress response gets activated. And what happens is we want them to be focusing at about 40 centimeters, but instead they're focusing at 6 meters or further away. And then these kids are the ones that suddenly it's like, oh, okay, I'm already finding this task stressful. And now it's not even clear. And what they'll tend to do is they'll start to bring the page up closer to their face, because if you bring things in closer, that actually switches on like an extra zoom in mechanism in our eyes. So they'll bring the text closer and they start to move their head more. And they often, as part of this sympathetic nervous system, they lose their peripheral awareness. So they get tunnel vision and they basically are only focusing on a couple of letters at a time or a couple of words at a time. And these are the kids just the wheels really fall off. So that's one of my favorite kind of undiagnosed vision issues in the kid that seemingly has perfect vision, but when they go to read, the wheels fall off. And often we just need to prescribe them some low powered plus lenses and they grow out of them within about a year or two. But it's just a little sort of support that we give these kids when they're going through this kind of learning to read phase and when that stress is activated.
So we've spoken about this before, where the kids pick up a book, their stress response kicks in, and then they bring the book up closer and closer to their nose, where like they're almost got the book right in their face and they're trying to read it. Is the best strategy then is to stop, try and calm before you continue to read?
Definitely. So one of the first exercises I do with all my kids when we do vision therapy is we work on breathing. So the cues I use, which I actually stole from Smiling Minds, which is the Monash University developed app. Have you heard of Smiling Minds?
Yes,
Yeah,
love it.
it's amazing. So I will direct a lot of parents to Smiling Minds and we talk about the cues of smell the flowers and then blow out the candles. And it's amazing how many kids just can't breathe. So we'll say, let's just do 3 big deep breaths. Then we're going to sit up nice and straight. We're going to make sure we're holding the page at the right distance. And the right distance, which I've told you before, Ash, is if we punch ourselves in the chin with our fist, the distance from our fist to our elbow, the end of our elbow, that's where we should be holding the book. So we get them to sit up nice and straight, hold the book, take a big deep breath, and then we try again. And that often will make a really big difference. Also, just making sure they're keeping their head still and not moving their head will also make life a lot easier because they stop losing their place.
Yeah. Okay, so what about writing?
Yes.
There's kids in our class. I've had many over the years. There's one particular one that stands out, and he just avoided writing like the absolute plague. Like any time he had to sit down and write anything, even his name, it was just like pulling teeth. Could vision problems be a hidden cause behind poor handwriting, reluctance to write, difficulty copying from the board, all of those sort of writing tasks that we have in the classroom?
Yeah, look, I think the first thing I'd say about writing, and I stole this one from Maggie Dent, is that boys are developmentally 2 years behind girls. And I think for kindergarten, for a boy, I think sometimes asking them to even write their name in kindergarten, and you as a teacher would probably know way more research on this, but I do think that sometimes the fine motor skills in these boys are just not there. They're not ready when they're first asked to do it. And if you've got a child that is a high achiever, or wants to do well, which look, most kids want to do. Which kid walks into a classroom and goes, I don't want to do well? So if you put these kids in a position where, particularly boys, where they're like, I'm going to fail at this, some of them just don't want to do it. I remember with my son in preschool, we were getting closer to the end of the year and I was like, all right, let's start working on writing. And he couldn't even hold the pencil in his hand. And I thought, oh my goodness, within a year, they do come along. I also think with poor handwriting, pencil grip has such a big part in it. I've actually just given my kids the old school rubber pencil grips that you shove
Yeah.
on the pencil. Both my kids have got that at the moment because I'm like, pencil grip is so important to handwriting. Definitely vision plays a part, absolutely no doubt. I think one of the things I find with kids with handwriting is that in our visual system, we have, if you think of your visual system, if you look at the wall right now and you picture you've got a square and you block that square into thirds, right? The middle third of your vision is like your central vision, and the outer 2/3 is like your peripheral awareness. And for a lot of kids and a lot of adults, if they're using their central vision, they switch off that peripheral vision. So they basically, if they're writing, I think some kids aren't aware of where they are on the page because they're so honed in on, I've got to get that perfect formation of the letter, that they almost lose their awareness of, okay, how am I going to space it and where am I going next? Does that make sense?
Yeah. There's a lot that goes into writing.
So much, so much. So I definitely think for kids with handwriting that vision, I think, plays a big part in that we need to be able to have that central and peripheral vision operating at the same time. And that's a very behavioural optometry concept. If you speak to ophthalmologists and general optometrists about central peripheral vision happening at the same time, they don't really understand what we're talking about. But we need all those things to be operating at one time. They need to know where they are on the page. They need to have the right fine motor skills. They need to be able to make sure they're at the right work distance. So I definitely think vision plays a part, but I could be controversial in saying this. I don't believe handwriting is, if a child comes in with a handwriting, I'm often saying, have you seen the OT as well? Because I think the OTs do a lot better job with handwriting than I would. Copying off the board, though, is a big vision one. So one of the skills that I assess in every child that comes in is a thing called accommodative flexibility or facility. And what that is, how well can the child go from zooming in to zooming out quickly? And if you think of copying off the board, the child has to look at the page and zoom in, then they have to look out at the board and zoom out, and then they've got to zoom back in, and then they zoom out. So that ability is something that, again, is not natural for a lot of kids. It's really quite easy to train it. We have really good vision therapy exercises that are really simple. They're free. You can give them to every patient that they can practice that visual flexibility. But that is a big one. So I think if you've got a child that's struggling to copy off the board, that's one behavioural optometrist can help with really quickly and really easily.
Yeah. So poor handwriting, no, not really. Maybe more of an OT thing, but that zooming in, zooming out, so copying off the board, yes, that's something to say, right, let's flag this child. Maybe they need to go and see a behavioural optometrist.
Yeah, and again, as I said, if there's an issue with handwriting, certainly get it checked. Most of the time when these kids come into me for poor handwriting, as soon as I get them to do, I have a test called the visual motor sort of test. It's a visual processing test where I get them to copy its shapes, and usually their pencil grip's atrocious. And I'm like, okay, can we just focus on that first?
Yeah. Yeah. Okay. So let's switch to some strategies now that teachers who are listening can actually try in the classroom if they suspect a child is struggling visually. What are some things that they could do? Of course, like stepping away from a diagnosis, because that's not what we're here to do as teachers, but things that we can do to support these students in the classroom. You mentioned the breathing techniques, which is something that I absolutely love.
Yeah.
Any other suggestions?
Yeah, so look, classroom seating is so important. Kids need to be looking straight at the board. And I understand with group work that we want them to be in a group, but I actually was in my daughter's classroom the other day and I quite liked how they set it up because I understand that the group work's important, but her sort of teacher has a few tables and then in like groups, but then she'll have a few tables that where there's kids sitting directly looking at the board and she moves them around all the time, which I think is not a bad way of doing it. But yeah, like in an ideal world, every kid should be looking straight at the board, not trying to turn their head to copy, because that is uncomfortable for even an adult. Good lighting's obviously important, making sure there's no glare coming onto the smart board from the windows. Another one would be making sure that the child is working at that correct distance. So that Harmon distance again is important.
So that's
Ensuring
the
that
one with the fist, the
yeah, the one
punching.
with the fist.
You
Yep, punch
punch
the
it
fist.
into your chin, and from
Yep,
the distance from your chin to your elbow is where you want your book to be reading, to be writing, and all of that stuff.
exactly. So making sure the desks and the chairs allow for that distance is good. But yeah, the deep breathing is a big one. As you said, that's probably my favorite one. But yeah, certainly for teachers, just looking at classroom seating. And if it is such they have to be seating in a different way, moving it around so they're not always having to turn their head one way or another.
Yeah. Lots of modern classrooms these days. The last classroom I worked in that was really modern had more than one electronic board. So they had like a big one at the front, but then they had an interactive TV on the side.
Yeah, that's a
Which
good
is
idea.
which is fabulous because then kids can be sitting in the groups. And I think a lot of teachers these days, they don't do as many copying off the board kind of activities, but they do need to be able to see if they're referring to a task that's on the board or what have you. It's important that they can see that easily without having to twist their whole body around.
Exactly. And look, obvious ones like if you are like writing on a whiteboard, do you guys still use whiteboards? Is that
Some classrooms have them and some
yeah.
don't.
Look,
Some have movable
use
ones, which is great, but yeah,
yeah.
it's very.
Use black and blue. Don't use green and red. Like that's not easy to read. So just those little simple ones that we assume people would think that makes a big difference.
Oh, I would suspect that many teachers don't know what the best colours to use pen-wise are.
Yeah.
I probably wouldn't have
So
thought of that. What about purple? Is purple okay?
Purple's okay. I guess that the one thing that we forget is that like 1 in 8 boys have a color vision issue,
Yeah.
So,
Okay.
and the color vision issues are around red and green. So ideally like black, blue, purple, they're probably your go-tos. If you're
Mm.
using red and green, there's 1 in 8 boys in your classroom that are going to struggle.
Yeah. Okay.
Yeah,
To get rid of those colors.
get rid of them.
That's an easy little switch to make, though. This is what I love about the podcast is that we talk to experts and we find out little tips that could make a huge difference to maybe just that one person in your classroom, but it's
Yeah,
making a difference, which is amazing.
yeah, 100%.
Okay, let's talk about ADHD for a minute. There's often a bit of confusion between vision issues and attention disorders like ADHD. How do you differentiate between vision related attention problems and something like ADHD? Because at the very beginning of the podcast, you said avoidance is a big sign to get your eyes tested. And as a teacher with my teacher hat on, I'd be like, oh, avoidance could be a big sign that a child is dysregulated and that maybe we've got another issue here.
Definitely. So, look, ADHD is certainly a tricky one when it comes to vision. Classic example, I had an example of a patient that I will never forget. So this little girl came in. Her dad was a scientist, my mum was a scientist, and they were very academic and they expected their daughter was going to be very academic. And she came in and I assessed her. And one of the tools that I use in my consult, which is my favorite tool, is a thing called a retinoscope. And a retinoscope is like this little torch and you shine it into the patient's eye and you basically look at how the light moves within their pupil. And that movement tells us what their script is. It tells us how engaged they are. It's my magic wand. And that's what we use when people go, how do you test a kid that can't read their letters? Or how can you test a baby? And it's like, it's this retinoscope. That's my like magic wand. Okay. And what I love about the retinoscope is it can show me where a child is attending with their vision. So anyway, this little girl came in and I assessed her and it was like her focusing system was all over the place. She was never attending on the task. I was like, wow, this child has a really significant vision issue. So we prescribed glasses. I was like, I want to do vision therapy with you straight away, which I don't often do. Often we'll see how the glasses go and then we reassess. And I got her in for vision therapy about 2 weeks later, and she performed like a superstar. And I thought, oh my goodness, this is what's going on. So I took her from the therapy room into my consult room and I said, I just want to remeasure everything. Something's not right. So I started remeasuring and her focusing system was perfect. She was attending on the task. I was like, what has changed? And I turned around to her dad. I was like, has something changed in the past 2 weeks? And he's like, oh, we started her on Ritalin. She's been diagnosed with ADHD.
Oh, gosh.
And I was like, oh my goodness. Honestly, Ash, I was embarrassed. I was a bit ashamed. I was like, how did I get this so wrong? Like, I really got this so wrong.
Yeah.
And I said, look, we probably don't need to do vision therapy. Look, the glasses, they're going to be beneficial. Let's just reassess. I was embarrassed. I honestly thought, wow. And at that point, I'd been out for a while. Like, I wasn't a new grad. Anyway, what it showed me was that attention attention and vision and visual attention are very intricately linked. If a child can't attend with their attention, their visual attention is going to be off as well. So where I come to with that is obviously a child that is having issues with their attention, we need to check their vision. The vision issue needs to be accounted for, but we also need to obviously be looking at opinions from a pediatrician as to whether we think that there could be something else going on. One of the things that I recommend to other optometrists who aren't sure. So say if a child comes in and you're like, is this a vision problem or is this ADHD? Optometrists can use, and ophthalmologists, we all can use a drop called a cycloplegic drop. And a cycloplegic drop is a drop that you put in the child's eyes. It takes about half an hour to work, but it stops their focusing system from basically working. So it basically knocks out their zoom in, zoom out function. If you take your child to an ophthalmologist, they use this on every child every time. So ophthalmologists, it's their mainstay. It's part of their gold standard. Optometrists don't use it as often for a few reasons. It's a bit traumatic for the child. So kids don't want stingy eye drops put in.
No.
It leaves them blurry for like 12 to 24 hours. So it can affect their ability to get on with the rest of their day. It also takes time. So you've got to put the drops in, wait half an hour, reassess. So optometrists tend to use the cycloplegic drops just on indication rather than every time. But in a child where I suspect I'm not sure if it's ADHD or a vision problem, I will do a cycloplegic on them. Because what that does is that then tells me, is there a big prescription here that we're missing or is there not? And a colleague of mine in the States, he actually had an example of a patient who she was on Ritalin, had been diagnosed with ADHD, came in for an eye exam. He put the cycloplegic drops in, and she was actually just really long-sighted, and it was actually just a vision problem where she couldn't see properly and it had been misdiagnosed. So it can go both ways.
Yeah, okay. So it can be diagnosed in the opposite direction as well.
100%. So I do think any child with ADHD needs to have a vision check and probably should consider, the parents should ask the optometrist to have those cycloplegic drops just as a way of ruling out that there's nothing being missed.
Yeah. There's so much to that. And I think as teachers, sometimes it's really hard to broach these topics with parents. Like,
Yeah.
as teachers, we all know, like anyone who's sitting and listening to this podcast or any teacher, that you just want the best for the kids in your class. And that's why you're approaching the parents saying, like, let's look at this, let's look at this. But on the other side, as a parent, it doesn't always feel that way, even though the teacher just wants the best for your child. What's a way that you could explain to families if you're thinking, okay, I've got this kid in my class, I think that we need to get their eyes tested. What's the best way to explain to families, like, this could be a good strategy or this could be a good next step for you?
Yeah, look, it's so hard. I really feel for teachers. I really do. Because I think often you're given a class of 20 to 30 kids, and it's your job to try to get them through a year of learning. And not every kid's going to find it easy. And then, yeah, you've got the parents looking at you, getting cranky if you make any suggestions because they take it personally. So, look, I would keep it as generic as you can. I think, certainly, as you said, just talking about, look, I think your child has potential. I'm not saying that they're reaching it at the moment. So let's just tick off hearing and vision. I think that's a really nice way of saying it, and just saying there's nothing majorly wrong, but let's just tick off a few things. Ideally, the behavioural optometrist is who you want to see, not just the general optometrist. I've heard general optometrists in Westfields actually refusing to test kids, saying, oh, sorry, we don't test kids here. So I think, yeah, isn't that bad?
Yeah.
But I think it's a really tricky one. I think just broaching it, just saying, look, I feel like your child has potential that they could be performing a little bit better. They're still doing super well, but let's just rule out hearing and vision. The other things I always talk about is like diet and environment. If the child's coming in from a broken family and there's terrible things going on at home, or if the child comes in and you can see they're not eating a good diet or the crunch and sip's not coming in, those little factors are certainly going to affect their learning. So you've got to take it all into consideration. But I do think, yes, seeing an optometrist or some sort of audiologist is a simple one. I know parents that have gotten their noses really out of joint because they've been asked to see a speech pathologist or an OT. And the speech pathology one, I always say to parents, we're not talking about their expressive language, which is their ability to speak. We're talking about their receptive language, which is their ability to understand the language. Because a lot of parents take it really bad. Like, my child can speak fine. And I always say, look, speech pathologists aren't just looking at that. They're looking at how they're taking it all in. So, yeah, it is hard. I don't know that I've helped with that question at all, Ash.
I think you have. I think too, if we just, as teachers, we just take the tactic, like, we want the best for your child. I am not the expert here, because we're not. We're experts in education, and we want all of these. There's so many other healthcare providers that can help a child get the best education that they possibly can. So you're saying you're not the expert. Let's go and get some expert advice and come back, because hopefully that will help.
Yeah, and it's interesting, like, I have parents that will come to me, yeah, quite upset because the teacher has recommended an assessment. And I say to these parents, like, the teachers don't have a lot more tools they can use. They're, as you said, they're experts in education. Sometimes they will need to outsource to get the whole team together to try and give that child the best opportunity. It's a really tricky one.
It is a tricky one. I do think a lot is expected of teachers.
Way too much, to be honest.
Yeah. All right. Let's bust a myth. What is one of the most common misconceptions about kids' vision that you wish every teacher knew?
Yeah. So I think dyslexia. Dyslexia is a bit of a passion project of mine. We know that 1 in 10 children have dyslexia. So dyslexia is in the brain. When they do brain scans, they can actually physically see an anatomical difference in a person's brain with dyslexia as opposed to someone without it.
Okay, just stop there for a second.
Yes.
People out there that say dyslexia, it's not a thing.
I know, it kills me. Like, it's there, it's out there. And I think in the sort of 70s and 80s, it got diagnosed a lot. And then there was this concern that people were using it as a label and they were using it as a reason to not try. And so it got almost decommissioned. But it's
Yeah.
there. We know it's there. So I think it's important we realize that for some children, reading, no matter what we do, it's never going to come easily. In optometry, we look at 3 different types of dyslexia. So it's interesting. We're not allowed to diagnose dyslexia. It's psychologists that is their domain. I don't know how it came about, but that's how it is. But in optometry, we are aware of dyslexia and we have tests that can look at it. And what I like about optometric tests of dyslexia is we look at 3 different types. So we look at visual dyslexia, auditory dyslexia, and motor dyslexia. And visual dyslexia is basically where the child doesn't see the word. So when I say the word broccoli, I see the word broccoli in my brain. It's like I see it on like a chalkboard. Does that happen to you?
Yeah, I see the word. It's not on a chalkboard. I'm just trying to think of what it's on.
Mine's on a chalkboard.
There. Yeah.
Yeah. So I see it. I see broccoli and then I just read it out from my brain. So kids with visual dyslexia, they don't see the words. There's no words going in. When they see a word, in most cases, they have to sound it out. So that's visual dyslexia. They don't see the words. Auditory dyslexia is where they can't sound it out. So they haven't got the phonics skills to sound it out. So they're the kids where working through your phonics and it's like, they're just not getting it. They're not connecting the sound to the symbol. And then motor dyslexia is where they're reversing everything. And one thing I didn't touch on in our chat today was BDPQ, right?
Oh,
BDPQ.
yes.
It's all a circle and a stick. That's all. They're all a circle and a stick. And if you've got a child who doesn't have a concept of where they are in space or doesn't know their right and their left, and that's 50% of the population doesn't really know their right from their left, this is pretty normal stuff. A circle with a stick on one side or the other, it's very hard to tell the difference. So with dyslexia, there will be some people that will have just one type of dyslexia. I've had patients over the years who've had all 3 types of dyslexia, and they're the kids that are literally nearly illiterate. So I guess that my main thing for busting a myth is dyslexia is there. It's 1 in 10. There's probably a couple of kids in your class that have it. How we work on helping those kids is they just have to work harder. So my dad's an optometrist and he always had the phrase, see it, say it, write it. So these kids, when they want to learn, I think if the average kid needs 8 exposures to take in a word and have it in there forever, a dyslexic child might need to see that word 600 times to have it in there forever. Sometimes it's 1,000 times. So see it, say it, write it is see the word broccoli, say the word broccoli, write the word broccoli, do it again and do it again. And there's no quick fix, but they do just have to work harder. It's interesting when I look at my patients who are dyslexic, who have often been diagnosed later in life, they're usually the most successful of my patients because they're so resilient and they've worked so hard and they're used to failure. And they end up being like the wealthiest people in the world because they're just so much more resilient than the average punter who it just came easy to.
Yeah, they've got that growth mindset.
Totally.
One thing that was really coming to mind as you were explaining that see it, say it, write it is that how we teach reading has really changed over the last couple of years, and it's all based on the research of the science of reading. And the science of reading really is about how you're explaining that. When we're teaching kids to read words, write words, it's all about breaking it down. And they say that the science of reading, kids learn how to read using the balanced literacy approach, but everyone has got a better chance at learning to read using the research of the science of reading. So I will put a link to some of the podcast episodes we've done on that in the show notes because I think that is such a good link there with that discussion.
For sure.
Okay, before we wrap up, I want to talk to you. I don't know if this is going to be a quick one, but let's just see screen time.
Yes.
Let's just have a little chat about screen time.
I love this chat. So screen time, one thing I like to split screen time into is TV time versus iPad time, Nintendo Switch time, handheld device time. From an optometry side of things, there's a big difference between that screen time and just watching the TV 3 meters away. So if we look at screen time generically, any form of screen time, to me, screen time is certainly going to limit your child's imagination. They're much better to be doing Lego, creating something, using their imagination, doing imaginative play, being outside. All those things are better than them watching a screen. But as parents and educators, there are going to be times where we need a minute and screen time is going to be introduced. So with the television, I don't have a huge issue with a child watching the television as long as the content is okay and age appropriate.
Yeah.
I hate YouTube. I think YouTube should not be, I think the government's trying to bring in bans on it for under certain ages anyway, but I don't like YouTube. But if we come back to like iPads and handheld devices, from a vision perspective purely, we have major problems with children working at that distance for long periods of time because our eyes weren't meant for that. And we're seeing around the world that the emergence of myopia and astigmatism, which is short-sightedness and distortion of vision, is escalating around the world because of the fact that so many children are based on, they're spending too much time up close and not outside. In China, and also when we look at sort of Asian countries where there's a lot more high density living, we're very lucky in Australia where a lot of children have a yard or they can get outside. But in areas in China, they've done studies on urban children versus rural children, and like the rates of myopia and major prescription issues are like so much higher in the city. So we know that like time spent up close is not good for the eyes. The Optometry Association has come out with 20-20-20, which means for every 20 minutes we spend on a handheld device, every 20 seconds we need to take a break where we look further than 20 feet away. So we need to stop that near focus, and then we need to look as far in the distance as we can. So I even say to adults, if you're working on your iPad or your laptop all day, every 20 minutes you need to like look away and look out the window and look as far as you can. And by breaking that kind of zoom in focus, we can try to help the eyes from adapting to that distance and becoming short-sighted, because that's what they do. They basically go, I'm looking so close for so long, I'll adapt the eyes so that close is clear and distance is blurry. But from a non-optometric point of view, I was doing a talk at a preschool recently and I flagged this, and the look of horror on people's faces, I went, wow, I thought this was something that everyone thought. An iPad is like a poker machine. You're hitting on it, you're getting instant verification. There's lights, there's colors, there's music, it's colorful, it's happy, it's dopamine hit. Same with the Nintendo Switches and any of these like devices. So I just think we have to be so careful with screen time. As I said, there's the visual side to it, but there's also the side that what it's doing to our brains and our addictive personalities. I was chatting to a friend the other day who's doing a counseling course, and she was saying that in gaming, like a lot of the games that kids are playing on PlayStation and Nintendo are actually, they're built on the same formula and same strategy as poker machines.
Wow.
Yeah. So they're literally like, you lose, you win, you lose, you win, and it keeps you going. And like these things are being made to create problems. So you wonder why your child gets off the iPad and turns into a nutter. Child's been playing on the Nintendo and their behaviors change. It's like you just had them on the pokies and you just pulled them off.
Yes.
I can't stress that one more. I just think we've got to be so careful with these things. And you wouldn't even then that's a whole nother chat with social media and all those sorts of things too.
Yeah, it is another whole chat. I've got one particular child, and you'll know which one it is, that if she spends any time on any sort of handheld device like an iPad, she's just like next level. Like you cannot manage this child. And she says the best part of reading groups in her class is when she gets to go on the iPad because she doesn't get to do it at home. And I just wonder how that poor teacher is dealing with all these dysregulated kids after they get off the iPads. In saying that, I never noticed that as a teacher myself. And you've got access to iPads and things, but maybe I wasn't tuned into it. I'm not sure.
Maybe when they're at school, they know they can't, they almost have to mask the dysregulation.
Yeah, maybe, yeah.
It's like at school, okay, that feels really bad, but I can't let it out, so I'll hold it in. Whereas at home, it's like I can let those firecrackers go off because I'm feeling awful.
Yeah. Yeah, fascinating. I feel like this is a topic that we could talk about for a full episode.
100%. I just say to parents, if the iPad's something that your child wants, it's got to be 20 minutes, then they've got to put it down and go do something else.
Yeah.
You just got to put time limits on. Just be so careful what they're looking at. Oh, I'm hearing terrible stories as our kids are getting older and what they're being exposed to by accident, and older siblings saying, type this into Safari. And just got to be so careful.
Yeah, you really do. I actually also find when you don't have it, they don't ask for it.
No.
It's when they've got access to it that then it becomes a problem because they're constantly wanting and asking. And I think the same's in the classroom as well. If you don't have iPads there as a tool to use, they're not going to ask for it. But as soon as they are there to use, I know from that grade 3 onwards, you say, okay, we can present our work in any way you like. It's your choice today. And there'll always be those kids that be like, can we use the iPad? Can we use the iPad? Can we do this, that? And if you don't have it there, then it's just not an option.
Totally.
I know there's going to be people that disagree with this. There's a whole level of controversy that comes with this, but sometimes it's hard to talk the truth about technology because it doesn't feel good when we've introduced all of these things into our homes and our classrooms.
100%. And look, again, I think COVID and that whole period people were working from home. It was a task they had to use. But I do think if the hard option is to say to your child, you can't go on the iPad, it's probably the right option.
Yes. Yeah.
It's easy. Everyone's happier if they're on it, but is it really the best thing for them right now? Probably not.
Yeah. Okay. Something that we finish our podcasts on is a question that a previous guest has left. So you're going to leave a question for another guest, but the question that's been left for you is, you've been given a blank billboard on the way to work. What message or image would you display?
Yes. So I would say that this one is for my friend Ashley Peake, who is a teacher as well. Get your skin checked.
Oh, I love that.
Yeah, nothing to do with eyes, but my dad had melanoma. Obviously, in Australia, we have significant rates of skin cancer. So, yeah, get your skin checked.
Yep, an easy one to do.
Yeah.
Amy, it has been an absolute pleasure. Can you tell our listeners where, or parents, teachers, parents, whoever is listening, where they can find more information about behavioural optometry near them and where they can connect with you?
Totally. So, the Australasian College of Behavioural Optometry is probably the best resource. So, that's www.acbo.org.au. You can find me on Instagram at Amy Fortescue Optom. At the moment, I'm not actually in practice. I will be opening up my own practice next year. So stay tuned. If you want to follow me on Instagram, you'll be able to find where I am next year.
So if you're living in Sydney, that is for you because that's where you're based.
That's me. Yeah, Southern Sydney.
If you're in the US, unfortunately, you won't be able to see Amy unless you're willing to fly all the way over down under.
That's right. But there are pretty much all our training from ACBO comes from the US. So Ash, I will get the link for any of the teachers coming from the US because I've got the link for them for their behavioural optometrists.
Amazing. We will put all of that information in the show notes. You have been such a wealth of knowledge, Amy. I've learned so much today. Thank you for coming and chatting
Thanks
with
for
us.
having me, Ash.
I hope you enjoyed that episode as much as I enjoyed it. One thing that Amy and I did not talk about are her eye exercises during the episode. Now, Amy has got these simple tracking eye exercises that can really help kids that have those tracking issues that we spoke about. So I will link her eye exercises in the show notes if you want to check them out or even print them out and give them to parents. It's a really good resource to have. As we learned, vision is so much more than sight. It's how the brain processes what the eyes see. And when we look at it in that regard, no wonder it makes such a huge difference to the learners in our classroom. Thank you so much, Amy, for sharing all of your wisdom with us. I know that there's so many teachers out there that are going to be so grateful that they heard this episode because it's going to help the children sitting in their classrooms, and that is what it is all about.
Thanks for choosing to listen to Rainbow Skies for Teachers, the go-to show dedicated to teachers who want to make a big difference in education.
If you enjoyed the episode, please leave us a 5-star review or share the episode with a friend. Because together we're
Unstoppable.